Time for a Serenity Hospice Care report on this Tuesday morning here on AM 1240 KFMO. It's 8:43. Got a current temperature outside right now of 48 degrees. And joining us in studio this morning to celebrate National Nurses Month, we have Stephanie Boyer, a longtime hospice nurse, and Lynn Boyer, who has been a hospice nurse for Serenity and deals with the comfort care and the palliative care program. And in discussing things with you before we started this interview, Shelley Odell, who's also here as well, we found out that you're not related, even though you share the same last name.
Right.
How does that work in the Mineral area, which is so small?
There's a lot of Boyers and Boyers.
We get that question a lot.
Yes.
I
Twice this morning.
I bet you do. I bet you do. Stephanie, let's kind of focus in on what you do as a long-term hospice nurse. What whenever somebody is admitted to hospice, kind of walk us through the process and where you come in and kind of the services that you provide.
As a nurse, come in and make my visits through the week. Help the patients and families walk through this journey of their life the way that they want it to be as much as possible, to just help them from day-to-day activities of, bathing, making sure the proper medications, making sure they're comfortable, being able to enjoy each day the best they can.
I know a lot of people talk about their jobs and they talk about monotony. Every day is the same thing. I would assume that your day does not go as planned, does it?
It never goes as planned. You just never know what's going to come up, and you have to be ready for quick changes and to think quick and just be able to help people in a crisis moment. If that comes up, that can alter your day very quickly.
I can imagine. How specific is the care towards each individual? Kind of talk a little bit about that and the different things that you do, because every patient, I'm sure, is completely different.
They are different. One of my favorite things to do is to come in each day, or say with each new patient, and say, what exactly do you want from me? What is your goal? Each time I come visit, what would you like me to do? Sometimes people just want you to sit there and talk with them. Just help them set up their medicines, and others require more care, so you're doing their bathing each day, or whatever they want. If they just want nail care one day, I'm fine with that, or if they just want to sit and talk.
What do patients usually want to talk about?
A lot of times they like to reminisce about family and things they've done in their life, which I think is amazing, to listen to people's stories of, their struggles through life and the good times and the bad times. And as they, walk through that journey of reminiscing, I think they make peace with everything. And it's really interesting to hear how people live.
How long have you been with Serenity?
For 15 years.
15 years. Are you one of the longer tenured nurses?
Yes.
Are you the longest?
No.
No? Who's got more on you?
Gosh, who is the longest? Jackie? No, I don't think Jackie is. I know Brenda Vinson has been there quite a while. Beverly Ernest. I'm trying to think, and now I'm stumped.
We're going to have to ask the HR department after the interview. There we go. Why does Serenity only use RNs and LPNs for their hospice patients?
Because we are able to go in and care for these people, and we can actually hands-on look at them, get the best assessments there is by doing the personal care, which is probably one of my favorite parts of the job. Excellent.
Also joining us this morning from Serenity Hospice is Lynn Boyer, right?
Yes.
You're a Boyer, not a Booyer. I'm sure that everything Stephanie said you're in agreement with as far as the job and kind of the service that you provide to the patients. What's kind of something special that Serenity does with their nurses that you're really proud of?
Well, we're a faith-based company, and when you just have nurses and RNs, LPNs coming in, instead of having an aide come in, you can make changes right away. If something's going on with that patient, they don't have to call the nurse to come and get something. We can make that change right then, call the doctor, do what's needed on that visit instead of scheduling another visit. The personal interaction with the patients is probably why all of the nurses stay, and they have the loyalty. Is we all come from different backgrounds, but we've been there where you just get that spot treatment of your patients. And with Serenity, you go in, you're with them 3 times a week, more than that sometimes. You build those relationships, and I mean, we all have people that just come up to us whenever we're out in public because we have a relationship with them, their family. We were there with them when their mom or their dad or their loved one was going through that. So it's a different kind of nursing. It's special.
You form a special bond with these people,
Yes.
don't you? You mentioned 3 times a week. I'm assuming that's average. You probably vary it to patient, right?
Well, you're going to get 3 visits a week, no matter what, with your primary nurse. But say something's going on, you've had a pain issue or something happened, you'll get, the nurse will be out there, or the on-call nurse will come. You're going to get more attention for those times when you're in crisis or you're in need. But definitely 3 times a week, as long as you're willing for that. Some people would they want to start out with 2 visits, but our norm is 3 times a week.
It's our Serenity Hospice Care report on this Tuesday here on KFMO. It's 8:49, 42 degrees. We're joined in studio this morning by Stephanie Boyer and Lynn Boyer, both nurses with Serenity Hospice Care. It's National Nurses Month. Shelley Odell's here as well. We'll talk to her in just a second. Lynn, I wanted to ask you about Comfort Care. Kind of explain how that program works and the services that are provided with it.
Well, Comfort Care is our palliative care program that Serenity offers to the community. It is a free service. We don't bill your insurance. We don't bill you. It's a totally free service. It is for people who are suffering from chronic illness, an injury, or something that they've just acutely been diagnosed with and are having some trouble managing their symptoms at home. We go in and you'll get a visit once a month from the nurse. And while I'm there, I do a total assessment. We work with their primary doctor, whoever their primary doctor is, and try to come up with a plan for them in their home. Say we go in and they are really in need of physical therapy, they haven't even thought of it. We can coordinate that for them. If their doctor has ordered labs and they can't get out to get their labs, we can draw their labs for them, take a UA for them. And a lot of times just talk to them about what's going on with them, what's going on in the last month. A lot of people are very frustrated, and it's hard to be dealing with these chronic illnesses. They don't know what is available to them, and that's something that we can definitely help them with. And, their families as well. It can be very taxing to take care of somebody who has a chronic illness month after month, and having an extra ear and having somebody come in and do the vitals and look them over once a month and say, yeah, you're doing a great job. That's important to people, helps them.
I know my grandpa was on Comfort Care for a while, and my grandma and grandpa loved it because they got another visitor, which they were always happy to see. And I believe Sue was her name.
Yes.
She came in, and there were times where my grandma was like, well, do you just want to sit at the table and play Rummy Cube with us? And she'd sit down and play, and did things like that. Because grandma's still, 83, keeps a very clean house.
Right.
So there wasn't much for her to do. But they really enjoyed the visit. And just having somebody with medical expertise to come in once a month just to check things is always a good thing, isn't it?
It is. And sometimes when you're at the doctor's office, they say, okay, we're going to order this med, this med, this med. And you go home and you may not understand what it is that you're getting these medications for. So whenever I come, I'll ask them, have you gotten any new medication? We'll go over it. A lot of medications need to be given in the morning or at night to work best. That sometimes people don't know that because you're just kind of pushed through if it's a busy day somewhere. So I have time to really talk to them about the things that they're concerned with, have questions about their disease process, and just life in general.
And you're in your home, you're more relaxed. things kind of come to mind a lot easier, because like you said, if you're in the doctor's office and there's a rush, you're in the pharmacy and there's a rush, it's here you go, get out the door. So this really gives people a great chance to find out the information they need.
Right, and from somebody that they know and have seen before and have a comfort level with.
Absolutely. Go ahead and slide that microphone up to the world traveler that is Shelley Odell there, the marketing director for Serenity Hospice Care. Shelley, wanted to ask you about some other things happening at Serenity these days, including a new medical director. Tell us about that.
We do. Dr. Jonathan Bird is our new medical director. He was actually an assistant medical director. Am I doing okay? Okay.
The microphone got turned off on you.
Oh, sorry. That was probably
okay.
my fault.
That's okay.
Dr. Jonathan Bird is our new medical director, and he was an assistant medical director for about the last 3 years, and has moved into our medical directorship at this point. So we're really blessed to have him in this capacity now. And he's a great doctor, has a great rapport in the community. And I mean, I think every one of us absolutely just enjoy working with him. He's an amazing physician.
If the nurses are shaking their heads, then that means he's okay.
Yeah, that means he's good.
Very good. New website. Tell us about that.
Yes, we do have a brand new website, serenityhc.org. It's still the same URL, but it looks very, very different. We've made it very personal and have our own nurses in all of the photos, in addition to some of our patients as well, so that people can get a feel of what our nurses do, and how intimate sometimes those relationships are with their patients and with the patients' families. And we want to be able to show that relationship and how close that is. And, we sit around a team meeting every Thursday and talk about, we're mandated by the state to discuss with our physician, our medical director, all the issues that are taking place with patients, and to hear those stories and I mean, to watch our nurses sometimes just tear up and cry about situations and how they love families. And I mean, it's such an emotional thing. I mean, I don't work directly with patients, but I get to work with them vicariously through our nurses and to experience that with them. And it's such an emotional situation, even for me, to sit back and watch that. So I wanted to be able to create a website that whenever an end user pulls serenityhc.org up, they can actually feel that intimacy and that closeness with these relationships with our nurses and social workers and their families and their patients. There's all kinds of things that we can do on the website now. For a healthcare provider, there's actually a healthcare provider tab that they can go to, and they can make referrals online now. Also, we provide training and in-services for facilities and their nursing staff. So we they can actually order those services online now as well, which our brand new website was only up 24 hours, and we already had a request for a new in-service. Plus, we already had a referral as well within 24 hours online for our palliative care. So, I mean, it's already, really going great. We've got lots of new videos. People can make consultation requests. So if they have just some additional questions about hospice or about palliative care, they can actually just fill out a very small form, just their name, phone number, contact information, and it will go straight to our director of social services, and she'll be able to contact them within 24 hours and set up a face-to-face meeting with them.
Let's talk about your radio campaign, because radio is the best advertising ever. Don't use anything else. No, just kidding. Why did you choose Jackie Murner and Elmer Roth? Why those people?
Well, Jackie Maynor is one of our longtime nurses as well, and she had such an amazing relationship with her patient, Elmer Roth, and we wanted to be able to show the community that relationship and what hospice work is about. And we want people who are considering hospice or know that eventually sometime they're going to have to be thinking about hospice. We want them to be able to see and feel that this is what hospice is. It's not about dying. It's not about giving up, but it's about our nurses and their work and our social workers and all those that work directly with those patients, providing the best quality of life in those last days. And that's really what we wanted to show people who are possibly, maybe in the future looking at hospice or even hospice right now.
Great story with Jackie and Elmer. And again, you'll hear the radio ads here on AM 1240 KFMO.